Well, good afternoon, everybody, and welcome to another briefing from the city of Albuquerque on all things coronavirus. So I want to begin by mentioning, I think, some good news in a sense of just how we're all coping and dealing with corona fatigue, but also trying to stay safe. And that is, of course, that we're very grateful to highlight the state's announcement that the rules around grocery store capacity are going to be relaxed. And so I know literally 2 nights ago, I was in line at Target. And that's pretty much what I've been doing every Monday night with a bunch of other Burqueños. And so for us, it's just helpful because, some of these stores, we know that restricting capacity is really important for health. But we also recognize some math involved, right? Like at Costco, the difference between 75 people and 25% capacity might not sound like a lot, but that's actually 520 people. That's how big the difference is, and therefore how less the line is going to be. So look, there's still probably going to be lines around town and so forth, but I think now, especially with that cold weather, this will just match the capacity to the size of the building. And so a very helpful and pragmatic change from the state. So we really appreciate that. And our fire marshal and our other enforcement folks will be working to, of course, adjust enforcement accordingly. Now, other things that we do want to touch on today is really that, while this is a good change, we also want to make sure that we're not letting our guard down. We're going to talk a lot about the vaccine as much as we know and so forth, but we also have to remember that there's still a long road ahead, unfortunately, for us. But the good news is there's just real hope. And I think even as I interact with folks around town and even over Zoom meetings and talk to different leaders in the community, I think we're all just feeling a sense of optimism going into 2021. And for good reason. 2020 has been extremely difficult, of course. So let's talk a little bit about where we're at in terms of vaccination distribution. The state's obviously provided an update and is quarterbacking the details around that with our hospital system and so forth. But our Emergency Operations Center, of course, has a role in that. But we do get a lot of questions about this. And so I do want to touch on some of this. And primarily, let me share that really there's three phases that the city of Albuquerque and the metro area are prepared for. Of course, we're in phase one, which is really just frontline healthcare workers and nursing homes. And as has been shared, there's about 56,000 healthcare workers in the metro area to get a sense of scale. And then, of course, there's some first responders depending on availability of doses. And so that's the focus for the time being. Phase two, which we don't really have any expectations on at this point, but when it is ready and begins to ship nationally, phase two will be overlapped with phase one, but phase two is really about populations that are at risk and essential continuity of government and public infrastructure and safety personnel. And so those guidelines are going to be set by the CDC. We basically plan on following CDC recommendations the whole way through in terms of parsing how and when different groups get vaccines. Now, phase three can, of course, also overlap with phase two if, again, the doses and the vaccine continues to roll out at a fairly rapid rate. And it may not, but if it does, phase three is really about the general public. And so we'll be talking about that down the road, of course, as more information comes to light. But I do want to share that the state yesterday, of course, revealed that they expect 70% of New Mexico to be vaccinated by this time next year. I think it's important to think about what that means a little bit. Number one, by this time next year, that means, a fair amount of the state, so that's a good thing. But I also want to mention that also means 30% of the state probably won't be vaccinated by this time next year. So again, just sharing and echoing what the state said, really to just let folks know in terms of expectations. This is, we know, going to be hopefully about a 6-month road to get out of a lot of these heavy restrictions. but it's going to be a year road to get everyone vaccinated. And so that's just, where we're at. And again, if things accelerate, awesome. But I think we need to be mentally prepared. It's not like everyone's going to be able to get a vaccination in a couple of months. That's just not right now a reality. And so just want to share that with folks, but we're going to be able to get through this. And I think between the CDC and the state, I think we're actually in good hands, and decisions are going to be made appropriately and certainly as soon as they can safely. Now, a couple of other items to share here. We are, of course, working with our partners on how we do that phase 3. And we have in place our different plans to activate a dozen or so different centers to provide those vaccinations. And we're considering different mechanisms on how to do that. But I think the short story is there's plenty of time for us to continue to plan for that, because phase 3 right now clearly is at least several months away. Even just to begin that. And so while this is, great news in terms of a breakthrough of vaccinations, there's no substitute right now for those basics: social distancing, mask wearing. These kinds of things are literally going to save lives until all of this can occur. And so these public health orders and restrictions and so forth, they are just as important, even if we have healthcare workers that have vaccinations. And so it's really important that we're in this for the long haul, or at least let's say the next 6 months or next year. Now, let me touch on testing a little bit. This is another important path out for the Albuquerque metro area. And when I say a path out of red, a path to orange, yellow. Actually, there isn't an orange, but a path to yellow, and then a path to green. And it's really because, the more folks that get tested, as long as they follow the rules in quarantine, it's going to reduce spread, and then we're going to have less high numbers overall. So in the meantime, that's how we can help not only each other and our families, but that's also how we can help businesses open. And so when it comes to testing, it's important to note that we have lots of testing sites available right now. And I want to let folks know, I think that the amazing thing is testing kind of has come in stops and starts in terms of, is there a line and is there availability? And the point right now is that it's actually very easy to get tested. We really want to encourage folks to take advantage of areas like the Balloon Fiesta. These are now by appointment, but basically you just register online, and you can call 311 if you have any questions on this, or the state public health lines. And these are through curative.com, and you get your results in 48 hours. And it's not invasive either. It's an oral swab, and there's almost no line because of the appointments. So right now, we're not anywhere near capacity at this site. And so I want to encourage folks to take advantage of that. And also, we have dozens of sites all over the city now where you can get testing, in addition to obviously private providers that many folks may be aware of through their doctor. And so for us, wherever you live, there really is a place where you can get testing that's convenient, where there isn't a big line. And in many cases, they can be this non-invasive type of test. And in many cases, a quick turnaround. So let me share with you a little bit about those locations. And so bear with me here as I get through here to our map and share this. So this map right here, and this is again available on all our different platforms and by calling, but as you can see, there are locations in lots of places. And so we continue to work on this. We continue to modify where testing's happening to try and get more people tested. But I would just say, please take advantage. And this is truly a metro area effort. You can see locations in Rio Rancho. You can see locations closer to the East Mountains. You see locations in the South Valley. So there are plenty of places where you can get that done. And of course, locations close to a freeway, which is just convenient access for everybody. One more that I want to highlight is actually our airport. There is now testing at the Sunport. So this is just another location for us. And I want to tell you a little bit about this. We, again, want to use every city facility we can, especially facilities where people are, to help provide these tests. And the Sunport is an example of that. Now, we know traffic at the Sunport is down 75% from this time last year. And, for obvious reasons, both from the industry perspective and the public health perspective and so forth. But we still know it's a convenient place to get tested. And so it's a partnership with Southwest Labs, who are making these tests available in a certain area at the Sunport. And you don't have to be flying in and out to go to that location. You're welcome to go to that anyway. And I do want to mention that these tests are done, they're not in conjunction to whether you're traveling or not. So in other words, if you get a test, it doesn't impact your travel plans, and vice versa. Or if you don't get a test, they just happen to be at the airport. And so there's a rapid test available with same day results. There's also a version that has 2 and 3 day results, and even a 24-hour type of test. So there's multiple kinds of tests available, and all the costs are out of pocket. But again, it's just another avenue which we can offer this. And testing is taking place at the east end of the ticketing level, just so you know where to go. And again, because the airport is so empty right now, this is a great facility with parking and plenty of space to actually conduct this testing. I do want to note, right, a negative test does not exempt anyone from the quarantine rules. So again, these tests are not an end around to any of the rules that the state has in place. So that's another testing location to know about. And we also want to highlight some partnerships that are developing with the state and some private businesses. And we're very fortunate to be joined by Secretary James Kenney, who's here from the New Mexico Environmental Health Department to talk about a program with Bueno Foods. So I'm going to hand it over to our secretary to hear all about this. Go ahead, Secretary.
Hey, good afternoon. Thank you, Mayor Keller. I appreciate you inviting me here, and I appreciate the opportunity to be here with you all. I, like you, share a lot of the optimism that we are turning corners here every day with vaccinations, but it is just as important today to get tested as it will be tomorrow. So with that, that's what I want to talk to the city about, is that we have a new partnership here in the South Valley, a partnership between an Albuquerque business leader, Bueno Foods, and Gene Baca, the Senior Vice President of Bueno Foods, is here, and what you'll hear from him in just a moment. But our partnership with Bueno, between the state and Bueno, gives us opportunity that we didn't have before, opportunity to test both employees, their families, and the larger South Valley community. And hosting a site in this area where Bueno Foods is located, an area of the city which has higher COVID positivity or higher numbers of COVID, that really gives us an opportunity, and Bueno Foods the opportunity to help save lives. And I don't want to underestimate that, because that's what we're dealing with right now. So we're really grateful that this partnership has evolved, that there's a testing location now at Bueno Foods, and the testing location has a couple of unique things in that Bueno Foods is providing some logistics to make sure people understand how to line up, how to get the testing done. They're offering English and Spanish instruction. So again, we're making sure that there's no obstacles or barriers to people getting tested. The site at Bueno Foods, we just finished our first 2 days, today being the second day. And we're estimating now that we've had about 300 people get tested over 2 days, and that's actually over 4 hours. So from noon to 2 on Monday, noon to 2 on Wednesday, today, we tested probably about 300 people. The testing is simple, Mayor Keller, as you indicated. This is a curative test site as well. You remain in your vehicle. Anybody who wants to go get tested, you remain in your vehicle. You administer the test by swabbing your mouth, and that's it. There's nothing more to it than that. It's fast, free, and easy. People with symptoms, this is really important, can unknowingly spread the disease. So getting tested is important whether you have symptoms or not. It's also the fastest way for New Mexico to turn from red to green, meaning particular counties, as you alluded to, can then move from red to green. There's also that yellow layer in between, but again, we're working towards moving in that direction. What does that mean when we move from red to yellow to green? That means fewer restrictions. So getting tested is a really important part of that. When you confirm that you're COVID negative, you help lower the positivity rate. So you may say to yourself, do I need to get tested? I feel okay. Well, go get tested. A negative test helps lower the positivity rate. That's important as we move forward and we work towards fewer restrictions. We move from red to yellow to green. So again, Mayor Keller, thank you for your leadership during the pandemic. And also thank you to the Albuquerque media for covering everything that the state is doing, the city is doing. We couldn't fight this disease without you helping to get our message out. So with that, I'm going to pass this over to Jean Baca, again, Senior Vice President of Bueno Foods. And Jean, go ahead and take it away.
Okay, thank you, Mayor Keller, for having me on your program here. And just want to thank Secretary Kenny. Secretary Kenny came to us with this opportunity last week, and we jumped all over it. Bueno has been in the South Valley. My family has been here, either lived here and had the business here for over a century. And of course, we've been in New Mexico for well beyond that time. So when we were presented with this opportunity, we jumped all over it, and we feel really grateful that we can actually help the city, help the state, and help the community try to stop COVID and try to help however we can. So we volunteered our testing site. We set our basically our parking lot as a testing site, and we're helping with logistics and translation. And so far, it looks like it's going really well. Cars are moving through really quickly. The test is absolutely painless. I took it today. It was probably easier taking the test than brushing my teeth. But so if anybody has any reservations about it, it's a really easy test. Results are back quickly. So we're happy to participate in this, and just as part of the community, we want to do everything we can to help the community, to protect our employees, and help protect our employees' families as well. So again, Secretary Kenny, thank you, and Mayor Keller, thank you for having me on.
Thanks so much, Gene, and great to see you. Of course, like all of us, we haven't seen each other in person in so long. Used to bump into you all the time. So thanks for this partnership, and of course, Secretary, great work on this, and a good example of why our Albuquerque metro area is actually leading around the region in the Southwest of all major cities in terms of access to testing and number of percentage of population testing. So thanks so much for that. And will no doubt just essentially keep us healthier down the road. But we still need more and more folks to take advantage. Again, this is the only way for us in the short term to be healthy, safe, and move to yellow. So with that, let's talk about a couple of other aspects in terms of where our city is at. And what I'll do now is go ahead and do a little screen share again. And let's take a look at some of our data. This is, I think we just got this a couple hours ago from the Department of Health. And so here's our status with respect to these gating criteria to move to yellow. And you can see a couple of obvious trends here. The good news is sort of a 20% improvement from last week. And so that's very good. But you also can see that we are still 10 times higher than we need to be to move to yellow when it comes to positive cases per 100,000. So, and the way this works, you obviously either decrease the number of positive cases or you increase the denominator in the number of those tested. And we've got to work on both ends of that equation. Now, looking at the other gating criteria, test positivity rate, again, you can see here, I think, a meaningful improvement. So that is very encouraging, especially coming out of Thanksgiving. But you can see we are still 3 times higher than the criteria to move to yellow. So this is why you hear me saying we have a long way to go. I mean, mathematically, we have a long way to go. And of course, it's the holiday season and so forth. So we just need to continue to be vigilant with respect to our own behaviors and also enforcement. And so we're going to talk about that in a little bit. Now, a couple of other aspects we always like to share a little bit about where we're at with respect to other cities in the kind of western part of the United States or the Southwest. And you can see the comparisons here. And I would actually basically just note in terms of this situation, we're pretty much the same as we were before. We look very good when it comes to percentage of testing, and we've lost some ground when it comes to positivity rate, but we're now, in sort of the middle of the pack. We're certainly not an outlier one way or the other. But it's a good reminder that up until October, we earned a reputation of being one of the healthiest places to live in a pandemic. And I believe that's still the case. And I believe our numbers are going to show that if we keep making the kinds of changes we've been doing. And so I think these numbers are at least moving in the right direction. And we certainly feel for some of these cities that still have extremely high positivity rates, Phoenix and Tucson. These are areas that there are just some major challenges. And so it is fortunate that here in Albuquerque, we aren't having to do things like massive curfews and so forth, which we would have to do if our rates began to look like that. So I think with that, this picture hasn't changed much since last week. So I'm going to go ahead and move on to our enforcement section. And with that, we'll hand it over to our fire marshal, Gene Gallegos. Marshal.
Mr. Mayor, thank you very much. So as you can see, the public health order team continues to go out to the entire city of Albuquerque and ensure that compliance is being maintained. Over the past couple weeks, especially last week, the public health order team has been working with businesses, specifically restaurants, on acceptable outdoor expansion. Again, talking with them about tents and their current structures on any type of improvements, or even on tents. Again, how many walls can a tent have up? Again, to make it simple, is you have to have 3 walls up for it to be considered an outdoor venue. So once you start putting multiple walls down, it's going to turn into an indoor venue, and they are not allowed. So again, we want to make sure and communicate with all these businesses, especially restaurants, on what is acceptable and what is not. If you have any questions, especially on existing structures, if you're going to improve that area, please contact our office prior to making those adjustments. We don't want you to spend money and then we go out there and advise you that you turned it into an indoor establishment. Again, I know that that's not your goal, and we want to help you in following the public health order. So please contact our office and we'll lead you in the right direction. So over the past week, our team has conducted 347 compliance interactions, 18 specific to wearing your face covering. Again, as the mayor mentions, the governor has lifted a little bit of the restrictions on grocery stores, essential businesses, to now that they can do 25% of their occupancy load. But again, that's going to relieve the issues of waiting in line. There still could be lines in the grocery stores, a busy time of year. Please have respect for each other. Again, wear your face coverings, maintain that social distancing. We do get a lot of calls about concerns of people not wearing their face covering in line. Again, we'll go out there, send either APD, code enforcement, or the fire marshal's office to talk with those individuals and issue any type of documentation if needed. So far we haven't had to do that, but again, please, everybody, maintain safety and follow the public health order. But we do continue to go out on every 311 concern and ensure that compliance is being held, and everything seems to be going great. So please continue the hard work, and thank you all the businesses, employees, and citizens. I now turn it back over to you, Mr. Mayor. Thank you.
Thanks so much, Marshal Gallegos. And for us, I think as we wrap up and be ready to take some questions, if there are any, just want to remind folks about a couple of things. First, as a last slide to really share with you, we continue to use, just as a guide, nothing is perfect when it comes to various tools to help us understand the virus and so forth, right? We just know that there are guidelines that really help. And so we continue to use this one in a sense of, you see activities that are very dangerous in terms of risk of spread. So any high occupancy situation where face masks are not being worn and there's prolonged period of time, that's in the bottom right of this chart. Again, that's where we focus enforcement. That's our priority. And then we try and follow up on those yellow areas, which are a lot of these gray areas in between. And then, of course, we can see activities with a face mask and low occupancy and outside that are very low risk activities. And so this, again, continues to guide our enforcement efforts and also can be helpful in terms of your own activities and what you're planning with your family. And again, this is, I think, an MIT and Oxford study there. So we'll continue to use that as we go forward. And in terms of other items that we wanted to share with you, I think really at this point for this week, we'll talk more going specifically into the holidays and also mention some activities that are COVID safe and appropriate for families and ways we can support our local businesses. We'll be doing that next week. But for this week, we just want to remind everyone really going into Christmas next week that, we know that there are still just real challenges. I mean, we had over 400 people die in the Albuquerque metro area because of COVID. And so most of us now know someone in our family or friends or in our network who has had COVID. And I think most of us can speak to a similar takeaway, which is that sometimes people recover and are okay, and sometimes they are not. And sometimes they do pass away within days, even if they don't have pre-existing health conditions. So COVID continues to have, in some ways, a very inconsistent impact on folks. And so no one should feel like they are in some way immune or healthy and that kind of thing, and so it won't impact them. We also know that a lot of people who've been positive continue to suffer from legacy effects for months after, including things like pneumonia, shortness of breath, and other challenges. So we continue to take this extremely serious, and that's what we've got to do going into the holidays. And so for us, I would also just add that in general, over the last year, the Albuquerque Metro has been a leader when it comes to health during a pandemic. And I want to continue to earn that status because it is going to help us on the way out. And it's going to help not only save lives, but I think we are demonstrating to the rest, at least of the Mountain West and the Southwest, that this is a really special place to live. And I'm grateful to live here. Okay, with that, I think we will transition over to some questions, if there are some, and I'll hand it over to Maya.
Hey, Mayor, we do have one question here from Jessica Dyer. So Jessica, you can unmute yourself.
Hi, you mentioned increasing the denominator in the testing positivity calculation as one way to get to the yellow zone or to maybe loosen restrictions. Are you encouraging anybody and everybody to go get tested now, regardless of symptoms or possible exposure?
Sure. We do want everyone to follow the CDC guidelines. So I would not encourage just like, oh, I'll just go get tested. That's not what this is about. It's about if you're worried because you were exposed. I think that's one. And again, because we tend to have more and more folks who are like, oh, I was around someone or I was at somewhere. So really, I would think about exposure and then, of course, symptoms. Those are really the two guiding principles. But obviously, because we're in a situation where we have extra capacity in the testing system, if you're in doubt, I think certainly I would go get a test. And I think that's a good place for our city to be right now. But again, we should follow the CDC criteria for that. And if you have questions too, of course, just call the DOH hotline, that same one that's been around.
Thank you, Mayor. And I think that wraps up the questions today.
Okay, thanks so much, everybody. We'll talk to you next week.